out in the real world because we think that's the best way to learn recovery. How can I keep them out in the real world without overdosing, without killing themselves? Now, what's cool is we're getting really close. You may have heard of Vivitrol.
I have.
Vivitrol is a drug that is a medication in which the individual is given it and it lasts for 30 days. I think it goes without saying we're going to create more medications like this that may last for 60 days or even longer. Now, when I talk with individuals, with people who have had heroin addiction and how they feel about Vivitrol, you know, it's one of those classic things. In some ways, it's fantastic. Because in some ways it basically prevents the individual from using the drug. They can use the drug, but they won't get high from it. So then their brain psychologically says, well, what's the sense of using that heroin? I'm not going to get high from it anyway. I don't have a choice. So in some ways, it's seen as a good thing. What's hard is we haven't quite figured out is the lore. The high of heroin is so intense that even if the person's off of it for 2, 3, 4 months using Vivitrol, sooner or later when they go off of Vivitrol, they still have similar challenges. Now, I still think we're on the right track. Which is better? Having person using Vivitrol out in the real world after a very brief rehab stay, or locking them up in a long-term rehab. I think the Vivitrol is better because it's back to the old driving, learning how to drive. They're in the real world. They're starting, yes, they can't use the drug, but at least they're starting to figure out, okay, how might I do this? I can't stay on Vivitrol at all, but how might I do this?
Did they get the side effects that that heroin would bring along? Like, if they don't get the high, do they get the side effects of like I'm not sure what the exact side effects are.
Yeah.
I know they're like bad.
Right. Well, that is a good question. We have other medications like methadone and Suboxone, and the downside of them is they're based on an opiate formula. So basically, they're an opiate without the high. That has been one effort. Vivitrol is not opiate based. So it's more of a medication that does not have the side effects as if you were on opiates. So what's intriguing to me is it seems like it's a good drug that does not have negative side effects, and it does prevent you technically from getting high. Just, it's important to understand though that that's only half the solution. So when I talk to these individuals who were on Vivitrol, these are actual patients, they all said, yeah, it really was helpful. But there's still a fundamental question. Well, you're all back in rehab. You've all relapsed. What happened? Well, it wasn't quite enough. Sooner or later, I stopped using Vivitrol, and I knew that it's not like I was going to stay on Vivitrol for life. I didn't learn the other skills, and then I got back where I'm at. I share the Vivitrol example because it paints a picture of where this is heading. Being locked up in a rehab or being locked up in extended rehab is not the solution. I think even those that run rehabs know that.